Hi everyone, thanks for coming to listening to our talk. Today we are going to talk to you about incivility in the workplace, and you have myself, Kelsey, Kyla, and Elaine and Alisa. So today we want to look at our objectives. We're looking at what incivility is, what does what does incivility look like, and how does it affect patient care. Then we'll move on to talk to you about how it does, affect the workplace as a whole, and what can be done to help, stop incivility in the workplace. I'll hand over to you.
All right, so what is incivility? Okay, well darn, I thought there was another. Okay, I'm sorry, I thought there was another definition that I typed in there. I guess it disappeared. Anyway, I did look up, our book was very brief about incivility. It just said incivility was just essentially rudeness and disrespect. So that wasn't much of a definition. I did check Oxford Dictionary, and it actually said incivility is all sorts of disruptive behaviors such as rudeness, disrespect, and uncooperative attitudes. So incivility is actually a whole range of behaviors, and it is defined as a form of workplace violence. It can be something as simple as ignoring somebody when they're talking to you, or it could be something as dramatic as threatening violence towards somebody. Research done by Pearson in 2016 stated that almost half of all workers in all workplaces have suffered incivility as frequently as at least once per week. And many who do experience this incivility pass on the effects to others. So think about it. If somebody's rude to you, that's probably going to put you in a bad mood, and you might very well pass that on to somebody else and not be too friendly with them. So I think what most shocked me was research by Frederick in 2014 reported that due to this incivility, 30 to 50% of all new nurses will leave the nursing profession sometime in their very first 3 years of nursing practice. Next. So I'd said that incivility is a whole range of behaviors. So Schwem in 2013 actually broke this down to 3 separate categories. She said that incivility could be something as subtle as eye rolling, just being plain rude to somebody, or complaining, or gossiping, or even teasing somebody. But from there, it can escalate to verbal aggression that would include intimidating somebody and threatening, or maybe cutting them down, belittling them in front of others. And unfortunately, sometimes it escalates to physical and even sexual aggression, throwing objects and actually physically shoving or hurting somebody. Next. Now let's test your knowledge on that short bit of information. Select all that apply. Identify the behaviors that could be defined as incivility. A, withholding information that could actually be helpful to another coworker. B, a general disdain or resentment of student nurses. C, lack of politeness. D, gossiping. Or E, condescending remarks. Actually, the answer is all of those constitute incivility. Another question, true or false? Uncivil behavior can be a form of bullying that can occur from physician to physician, physician to nurse, nurse to nurse, manager to a subordinate, or even nurse to patient, or actually patient to nurse. True or false? That is actually true. Incivility it can be called bullying, but to meet the requirements of bullying, it actually has to be repeated behavior. There has to be a target. There has to be a target for it, and it has to cause harm to somebody. And that harm can be something as simple as just mental harm, such as somebody doesn't want to come to work because they're being bullied. Next.
So how does incivility affect the workplace? And simple answer to that is an unhealthy work environment impacts everybody on the unit. Conflict and tension creates a negative workspace, and that's going to affect job satisfaction. It will create a less cohesive teamwork among staff because of conflict. It increases anxiety and withdrawal for those who are victims of incivility. And as the statistics from these two studies show on the slide, there is a large percentage of these nurses who will, because of the negative environment, they will lose passion for their jobs and willingness to contribute to the organization. So they are more likely to intentionally cut back on their efforts. And those kind of behaviors are going to affect the unit as a whole in productivity and in patient care. And when a nurse is repeatedly bullied by their coworkers, they're likely to increase the amount of calling in and taking sick days, eventually marked for absenteeism, and that can give grounds for firing. And so that it has socioeconomic consequences as well, because it leads to unemployment for these nurses, as well as whether these employees quit or they're fired, there's a higher attrition rate, and the process of frequently hiring and orienting new staff is costly to the organization. So we've all heard the phrase that nurses eat their young. So this question is asking, what does this phrase represent? Select all that apply. A, new nurses often yell at older coworkers to establish themselves as dominant. B, the bullying and harassment of new nurses. C, the growing trend of cannibalism in the nursing profession. And D, a hidden culture of hazing new nurses often meant to humiliate, offend, or distress the new nurse. And the answer is B and D. The nursing professor Judith Meisner coined this phrase in 1986, and it still pertains to this day.
So we're going to talk now about how incivility affects patient care. And this will sort of just piggyback off of a lot of what Kelsey said. But bullying and incivility, they impact absenteeism, turnover, productivity, and as a result of that, it decreases quality of care. So bullying poses consequences to patient care because the care of an affected nurse often decreases significantly in quality. So you could think, they might feel anxious at work. They might feel like they're working in a hostile work environment. They might be second and triple guessing themselves all the time. And one big thing that I think I mentioned here later is just the passion, right? So like a lot of new nurses go into the field and they're really eager and excited and they want to help people. But unfortunately with incivility and bullying, I think that gets sort of beaten out of people pretty quickly from what we're reading. The Sentinel Event Alert was released in 2008, and it said that intimidating and disrupting behaviors can foster medical errors and lead to preventable adverse outcomes. And then there was some information about how turnover and absenteeism, they essentially create like a revolving door of nurses entering and leaving the profession. So rather than nurses staying in the field and gaining experience on a certain unit, after 6 months, we tend to see that a lot of those nurses leave for different units, right? So they're not getting a ton of experience in one specialty starting off, which just leads to, again, like a decrease in patient care, right? From there, this was kind of a personal note, but you could infer this from a lot of what I read. It's just that nurses are meant to be compassionate and empathetic caregivers. We all know that. It's been taught to us since we started nursing school. And if we continue to allow a culture of bullying, how do we expect these crucial characteristics to survive in the field? And I think the short answer is they won't survive unless something is definitely done about it. So then I was going to offer up two sort of reflections. The first one is just to think about your own experiences. So a lot of us have only been to clinical rotations and whatnot, but in those clinical rotations, have you witnessed bullying and civility or just sort of like snarky behavior, or have you had it happen to yourself? And when we started this project and I started to kind of look at stuff, I was kind of shocked. And it wasn't terrible, but I think even so far in my 100 hours of clinical experience, I've not only witnessed it, but like experienced it myself, which was kind of shocking. And that's a big bummer. And just as an add-on to that, I think it's important just for new nurses to think about how they might respond to incivility, right? So it's something we are likely to face. And if you can sort of come up with a game plan of how you're going to handle yourself in those situations, if you can kind of think about like how you might react in one of those situations, when it does happen, it might not be as catastrophic, right? Because you're going to know how to handle yourself. You're going to have a game plan, and you can kind of move forward with it, hopefully with a bit more grace, and you won't be completely thrown off or disheartened. Then I included a link from the Joint Commission a little soon. Really, this just talks about patient safety and how it's related to incivility. So you can click on that if you want more info. All right, now we're ready. All right, cool. So test your knowledge. What percentage of new nurses leave their first position within 6 months due to some form, sorry for all the typos, of verbal abuse or harsh treatment from a colleague? A was 20%, B was 30%, C 75%, or D 60%? And the answer is actually 60%. So what we were talking about earlier is that new nurses enter the field, say they go work in oncology. Within 6 months, they're so beaten down from incivility and bullying that they leave the specialty that they're in for a new unit to where they have to learn entirely new skills. And that just, again, leads to nurses that don't have quite as much experience working on these floors.
Okay, so jumping off of that, what can be done? I mean, now that we know what it is, how it affects nurses, patient care, it's easier said than done, I think. You're supposed to cultivate a culture of civility. And that starts, I think, from the top down. So hiring ethical and principled leaders, and also encouraging stress management, just because it's such a grueling job day in and day out. If you're not addressing the stress that's building up, you can tend to take it out on other people. I think too, being a positive role model, whether you're a new nurse, whether you're a seasoned nurse, whether you're the manager, and making sure everyone feels comfortable communicating with each other is really important. Listening to others' opinions, especially, but also demonstrating respect, showing appreciation, giving credit for people that have done a good job at something. And I mean, just practicing being polite to each other, saying please and saying thank you. All of this seems really easy, but nursing is sometimes a thankless job, and we don't want to be taking it out on other people. So Nurse Blake, if you haven't heard of him, he's kind of an advocate for discouraging that eat their young mentality. So this is just a funny picture quote from, like, just be nice and stuff. Nurses shouldn't be eating their young, they should be eating potlucks. So what are strategies used to cultivate a culture of civility? Select all that apply. A, demonstrate respect. B, hire leaders with questionable principles. C, avoid open communication. And D, give credit for a job well done. So it's A, demonstrate respect, and D, give credit for a job well done, because you want to hire leaders that are ethical, and also make sure communication is always open. So these are also a few more jokes. Talking about nurses eat their young, you say false. Nurses do not eat anything for 8 to 12 hours at a time. And he also said, as other nurses follow in our footsteps, we need to always inspire, motivate, and help them. We are all in this together. Nurses support their young. And these are some of our references.